Welcome everyone to Staying Safe with COVID-19, What People with Chronic Illness Need to Know. We're thrilled to be holding this webinar live today. It's also being recorded, so if you happen to miss it or need to drop off before it's over, this will be available on our site. We've been conducting webinars just like this one that are targeted for a patient audience for quite a while now, a couple of years. And these are all available online on creakyjoints.org, our website. We can share the link with you at the end of this webinar. We'll send out an email to all of the people who participated, and you'll be able to see and browse our other webinars with some of the experts in the field. Topics mostly are on the latest research in rheumatic and musculoskeletal conditions. We're thrilled to have this topic. COVID-19, of course, is the event of 2020, whether we like it or not. Probably mostly we don't like it. And there's some important information, constantly changing information that it's important to know. So as I mentioned, this webinar is being recorded. It will be a 60-minute webinar. And there will be an opportunity for questions and answers at the end, a Q&A. So the recording will include that Q&A, and we'll post it for you to listen to later on if you miss something that someone said, or for you to share with others. Just a couple things to note with the Q&A, that we may not be able to answer every single question that comes in due to time constraints, but we'll try our best. It's a very important component of this to make sure that we're responding. This is one of the few opportunities we get to talk to experts live and also hear from patients and their concerns, and we'll try our best to answer the questions. In some cases, what we may do is, if we see some of the questions coming through that are similar, we may kind of bundle them up and ask them as a more generalized question, or even for someone's individual question, we may generalize it a bit just so it applies to everyone. If we don't get to your question during this webinar, then I'd like to apologize in advance. We'll work on answering them later and send them to you. Please note that to ask questions, you'll see in the little corner, at least on my screen, it's on the right-hand corner, there's a question section. So if you click on that and enter your question there, then it'll pop up for us, for the staff, and we can take a look and make sure to get that question answered either during this webinar in the Q&A, or we'll do our best to get it answered afterward. So please note that all of the audience members are on mute. So we do encourage questions throughout, but you'll have to type them in. And the only people that you'll be able to hear are myself. This is Ben Knoll. I'm the Director of Patient-Centered Research with the Global Healthy Living Foundation, and the Principal Investigator for Arthritis Power, our research registry. And you'll also be able to hear our two speakers, who I'll introduce in just a second. So again, today's webinar is Staying Safe with COVID-19, What People with Chronic Illness Need to Know. And now that it's been, almost probably 8 months now since the pandemic began, there's a lot of information that has bubbled up as we've learned more about this disease. Not only that, there's things that have changed. So some of the messaging that we heard at the beginning of the pandemic may have altered somewhat, and so it could be kind of confusing. So we wanted to take the time to clarify how this works, what people need to understand. So with that in mind, let's see. I'm gonna close this. Our two speakers today are Lauren Gelman. She's our Director of Editorial Services with the Global Healthy Living Foundation. We're delighted to have Lauren join us. She's an integral part of our team at GHLF, and all of the great content on the creakyjoints.org website is really thanks to her. Lauren directs our team of writers and seeks out the cutting edge research and the kind of compelling topics that you see on Creaky Joints, and that's constantly being renewed and refreshed with new and interesting stuff as we learn more about it. We're also joined by Dr. Mike George. He's an assistant professor of medicine at the University of Pennsylvania, and he's a rheumatologist, and he specializes in this area, actually, in understanding common infections, infectious disease in the context of rheumatology. And Dr. George is one of the people who led our COVID-19 project. So some of you on the call may have participated in the survey that we conducted over the past several months around COVID-19 about people's perceptions, behaviors, concerns in this new reality. So our agenda today is that we're going to cover COVID-19 and the transmission routes. In other words, how does it spread? You know, how does COVID move from one person to another? And then a related issue is, how do you protect yourself and how do you protect other people? How do you stay safe and try to minimize your risk of becoming infected with COVID-19 and minimize your risk of passing it on to other people? And then finally, something that can be more complicated, I think, for all of us is, how do you weigh those risks and make decisions during this pandemic that's still going to be with us for a while? So we talk about, as you can see there, the little graphic of a mask and those kinds of discussions, and we'll try to debunk some myths along the way, because I think, again, there's a lot of information confusion, as some information has come and gone and some information has come to be new during this time. So with that, I'd like to pass it on to Dr. George to begin the discussion.
Thanks a lot, Ben, and thanks to everyone for joining, and also thanks to those of you who have participated in the COVID-19 project. That's been really helpful, and we're continuing to learn things from that. And we're continuing to learn things about COVID-19, so of course, the information that we're sharing is the best information we have of today, and we'll try and highlight where there's still uncertainty, and things may change in the future, but we'll try to give you the up-to-date information here. So let's talk about COVID-19 transmission routes. Okay, so first, it almost feels like we don't need an introduction to COVID-19 anymore and what this is, but we're going to do it anyway. Make sure we're all on the same page. You know, COVID-19 is an acronym. It stands for coronavirus, and the D stands for disease, a novel coronavirus related to SARS and also common cold viruses called the coronavirus. And the virus itself is called SARS-CoV-2. This is a viral illness that can affect the lungs and airways, and as you know, common symptoms can be fever, cough, shortness of breath, as well as some more uncommon symptoms or unusual symptoms like loss of smell and taste, which I'm sure you've heard about. So what have we learned about the transmission over the last 7 months? So we've learned that COVID-19 is certainly easily transmitted. Probably more easily transmitted than influenza, and can cause serious and life-threatening health concerns. It can cause systemic inflammation, so while we worry a lot about respiratory illness and pneumonia, it can cause systemic inflammation and affect the whole body. And the symptoms can last a long time. So, you know, the people who've recovered from COVID-19 can continue to have residual symptoms that can last for months. We don't have a vaccine available at this time, and this is going to continue to take time to get the right vaccine and to get it distributed, but there's a lot of work being done there. But we do have other measures which are really important right now and are going to continue to be important over the next months to help control the spread of this and also to keep ourselves safe. So how can this spread? So there can be spread on surfaces, although this is the less common route of transmission. So it is possible to get COVID-19 by touching a surface or an object that has the virus on it, that someone else has touched or that droplets have landed on, especially if we then touch our own mouth, our nose, our eyes. We're still learning more about this. You know, I'm sure you've read things about how long it can last on this surface or that surface or this or that. But I mean, I think the key, as opposed to getting hung up into some of those studies, is to routinely disinfect and clean surfaces, especially common areas that you're going to, if you are at work, cleaning those common areas and the common surfaces you use, keyboards, toilets, faucets, sinks, and washing your hands with soap and water for at least 20 seconds frequently, or using an alcohol-based hand sanitizer, and of course avoiding contact with your eyes, nose, and mouth with your hands. The more common spread seems to be person-to-person spread, that it's mostly through respiratory droplets. So these small, tiny droplets can hang in the air for minutes to even hours and are spread by talking, coughing, sneezing, singing. We're making these droplets all the time. And I think this is important to kind of understand, because it does help you understand also what kind of measures you can take and what sort of activities are higher risk or lower risk activities. So especially poorly ventilated indoor areas with close contact with others, these are the highest risk things because these droplets can hang around the air for quite some time. The other important thing that we've learned, highlighted on this slide, is that even people who are asymptomatic can spread these droplets. And so this is pretty common. About a third of people with COVID-19 are asymptomatic, and transmission also happens before people even feel sick, and these droplets can be spread in the air just with talking. So indoor areas where these droplets can be hanging around are particularly high-risk areas, and areas where you're close to people, where you're close to where those droplets would be created. So who can spread the virus? So all of these groups can spread the virus. People who are asymptomatic, so these are people who do not have symptoms and never will develop symptoms. In fact, maybe we'll never know that they even had COVID-19. People who are pre-symptomatic, so they're going to be sick a few days from now, but a few days before they actually develop symptoms, they're shedding the virus. And so that's why if you're in contact with someone and then 2 days later, they get sick and find out they have COVID-19, I mean, that's a risk because that person could well have been spreading virus before they showed symptoms. And then of course, symptomatic people. And this is a particular concern. I mean, people who are coughing, sneezing are probably spreading more droplets, but any of these groups can spread the virus. So, and there's been some studies out there about how likely this is. So really, how likely is it for someone who's asymptomatic to spread the virus? And it seems that those people can be just as likely as others to spread this virus. Now, they're not coughing or sneezing, and so maybe they're producing fewer droplets, but still, even with talking and normal activities, we're producing droplets, and they seem to have just as much virus as people who have symptoms. So the amount of virus that people are detecting in the nasal passages and the oral passages is the same level. And so the potential for spread is the same. There's been a lot about super spreader events, which is, the term super spreader, I feel like it's just a very scary term in general. But this is the idea that there's a small number of cases that infect a large number of people. And I sort of don't like the term super spreader that much. It almost seems like it's like that person, there's something about that person that makes them, really infectious and infecting everyone. It's probably more the activities that are the issue. This is typically happening in crowded places with poor ventilation, but we know that these super spreader events, these places where there's a lot of transmission, are responsible for 80% of coronavirus's spread. So this is actually super important, and identifying high-risk areas and high-risk times is very important in terms of controlling the spread of COVID-19. And what about children? I mean, my son is in hybrid kindergarten, so this is top of my mind. Are children super spreaders, or to what degree can children spread the virus? It has been, I guess, a blessing to discover that this disease seems to impact children less than adults, although some children can certainly get quite ill from this. But they do seem to carry the virus at the same levels as adults. So there is certainly the potential for children to spread COVID-19 just like adults. And in fact, since they may be less likely to get sick, asymptomatic spread could be a concern in children in particular. So the key from here is, I don't think we need to worry too much. Is it more, is it less of the same? But we should know that children can spread this virus just like adults, whether symptomatic or asymptomatic. Okay, so again, incubation period is an important thing to be aware of, and why is this? Why should you know about this? I think incubation is particularly important if you're coming in contact with someone and you're worried, oh gosh, did I get this? Am I going to get sick? How long is it usually between being exposed to the virus and when you actually get sick? So the median incubation period is between 5 and 7 days, meaning that within the first week, about half of all the people who will get sick are sick. But it's out to more like 11, 12, 13 days before before almost everyone who's going to get sick is sick. By 2 weeks out from exposure, 99% of people who are going to get sick have been sick. So if it's been 14 days since you were in contact with someone with COVID-19 it's quite unlikely that you're going to develop it from that exposure. And then, flu season is emerging, and so we're still waiting for a COVID vaccine, but we do have influenza vaccines. And so this is very important for multiple reasons. So, it remains to be seen exactly what flu season is going to be like this year, but it's likely to put further strains on our healthcare system. If we have hospitals that are crowded with COVID-19 and influenza, this is going to be a major problem. Also for your own health, the influenza vaccine is always important, and you can even get COVID-19 and influenza at the same time. That seems like the worst case scenario, but it is possible. We know that no vaccine is perfect. The coronavirus vaccine is not going to be perfect. The influenza vaccine is not perfect. It's not like you can't get flu if you've gotten the vaccine, and the same is certain to be true of the coronavirus vaccine, but we do know that it reduces your risk of getting sick, and if you do get flu, it makes it more likely you're going to have a mild case of flu instead of a more severe case. Okay, we're going to move on to kind of taking some of that knowledge and talking about protecting yourself and protecting others. Okay, so masks. Now, this is obviously an issue that's been very prominent throughout this. I did a podcast early on in the pandemic, and I now somewhat regretfully remember discussing at that time the CDC recommendations where, we think the most important people to wear masks are healthcare workers or people who are sick who might be spreading this. But we've learned a couple important things since that early time that have really changed this dramatically. First, and the point that we've made a couple times here already, is that we learned that asymptomatic people can spread this virus. And that's really been a game changer for mask wearing, because we know that it's not just the people who are sick that can have a mask prevent droplets and spread, but the people who are not sick but maybe carrying the virus, this can prevent spread from those people as well. So you might not even know that you are sick and spreading the virus. The mask can help prevent that. So that was very important. And secondly, we learned that the virus is quite transmissible. And then third, we learned that cloth masks and home masks can be quite useful as well. And so some of the shortages that we've seen at the healthcare setting and worry that surgical masks are being diverted from that, no longer the case. And fortunately, many companies have seized the potential profits and are making masks. So I think there's widespread availability now as well. So masks, very, very important now at preventing the spread. And there's been multiple studies showing how important these are. So myth, that wearing a mask only protects others and not me. So actually that's not true. I mean, that is quite important that it does prevent the spread of the virus by preventing us from spreading droplets, but it also will protect us. These masks do filter out viral particles, and especially the droplets. These are carried on droplets that are, a little more than microscopic, and that can be blocked by the mask, so we're not inhaling it, getting it into the nasal passages or our mouth to have spread. It's also possible, and I think this has been a very promising thing, that it may lead to a less severe disease. So the idea is if you get less exposure to a virus, if you get a very small virus exposure, maybe you just get mild illness and you recover from it, and then great, you're more protected. And actually some early vaccines many years ago were based on this idea that giving a very tiny amount of a virus could lead to protection, or a heat-killed virus leads to protection. So the same seems to be true here. Getting a small inoculum can actually be a good thing. So here's some of the data behind this. Do masks reduce exposure to the virus? So if 80 to 100% of the population is wearing a mask, this would lead to substantially less exposure and a lower death rate based on several studies. And I think this has been a prominent thing of how many cases can we avoid throughout the country if everyone's wearing a mask. And some evidence also about this idea that it might lead to less severe disease if heaven forbid you are exposed, you're only exposed to a very small amount of the virus. The study in San Francisco showed that people who wore masks, the majority had mild to no symptoms. So the idea that being, hopefully, if they were exposed, they were just getting a very small amount of the virus exposure and their body could fight it off easily. Okay, so what does this tell us? So this seems to mean that wearing a mask can protect you. Also, if you are exposed, it might lead to a lower dose of the virus and a less severe illness. And this is also very, very important. You know, I think we can't forget the first part, that preventing the spread is very, very important. Okay, I'll turn it over to Lauren here.
Thank you. So the next part of this presentation, we're going to talk a lot about the different choices that we can make regarding the activities that we're willing to participate in as our lives have started to reopen a little bit over the last few months. And, you know, I want to approach this section with a great deal of humility, because I think, you know, we all know what we need to do to stay safe. You know, the things that we can do to stay safe are relatively simple. And Dr. George talked about these: social distancing, wearing a mask, avoiding people who have symptoms. It just how these apply to our everyday lives and the many, many decisions that we make throughout the day, especially over time and as pandemic fatigue sets in, can make this more challenging. So at Creaky Joints and the Global Healthy Living Foundation, we've been fielding a lot of questions from our community over the past few months and have developed a series called Is It Safe? That looks at a lot of the daily or regular activities that people may have questions about, whether that's getting manicures or haircuts or flying on planes or carpooling with their kids, all of these things that we have to make decisions about. And at the end of the day, a lot of it really just comes down to our own personal willingness to take risk and where we're willing to take risk. The other factor, and this is, you know, really challenging as, you know, where everybody is from across the country, GHLF, you know, it's not just a US organization, but an international organization. And what we've seen is clearly, you know, what's happening in your local community has a really big impact on some of these choices. So let's, if you want to advance to the next slide. You know, I think at the end of the day, every activity, you know, that you leave your house for introduces some degree of risk, but you know, it's a little bit different than things were in the first couple of months of the pandemic, and people are, you know, leaving the house a little bit more than they were. So what we're going to talk about is ways that we can make activities a little bit safer, or things to keep in mind as we're evaluating whether an activity is right for us. You know, one thing that experts tell us is that just because something is open or just because something is available to you doesn't mean that it's safe, especially without the proper precautions. And, you know, the other thing to keep in mind is, as all of you know, we can very much control our own behavior, but we can't always control the behavior of those around us. And that plays a really big role in whether a given activity ends up being safe. So let's dive in a little bit more. If you want to. So a couple of numbers here. You know, community spread is, you know, how prevalent the COVID-19 is in your local area. And, you know, reporting can vary by state. But a couple of things to keep in mind if you're trying to get a sense of how prevalent and widespread COVID is near you is looking at the new cases per 100,000 people. And it's been suggested that the safest number is less than one new case per 100,000 people over a 2-week period. Now, that's a very high standard. I took a look at Stat News has a tracker that allows you to look at this fairly easily. And where I live in the New York City suburbs in Long Island, we're at about 5 right now. A couple of the states in New England were below 1, Vermont, I think. But most places that I looked at random were well above 1. And then the other one is the percent positive rate. And ideally, this would be less than 5% of tests that are done on COVID come back positive. And these numbers are not, you know, if you live in an area where these numbers are somewhat, you know, being met, it's you know, it's not carte blanche to go out and do all the activities that you want to do, but it can get, if you're very, very far away from being in an area that, if not physically far away, but if the area that you're in is very far away from meeting these numbers, it's a sign that we really need to proceed with caution, because a lot of activities, especially given what we saw earlier in the presentation about asymptomatic carriers, can introduce you to COVID unwittingly. So we did, as part of our coverage at GHLF, we have a program, many of you on this webinar might be part of it, called the COVID-19 Patient Support Program. It's a free program. You can sign up for it. You get weekly emails that provide the latest information and news about COVID, specifically through a lens of people who are living with underlying health issues. And as part of this program, we do a lot of polls to understand what people are thinking, what their concerns are, so then we can develop content in response to them. And so I think the week before last or recently, we did a poll about how people feel about participating in everyday life activities. And one of the things that is important about our organization and this program is helping all of us feel united when maybe the rest of the world, or it seems like the rest of the world, might be on a different wavelength. So we asked people about what it's like for them, and what we learned was that about 25% of people said that they felt like others in their lives do not understand their need to take precautions regarding the pandemic. And that's really hard, right? If the people around you, maybe you're opting out of certain activities and the people around you don't understand. And even worse, I think it's just shy of 20% of people reported that others around them are saying or doing things that make them feel guilty for not participating in activities with them. And that's really hard, because we're going on, 9 months now, and this is going to continue for some more time. And, what we hope with activities like this webinar is arming you with information to continue to make the choices that feel right to you, and not necessarily feel like you have to succumb to what those around you are doing. We also wanted to know how people felt about the behavior of those around them, because, like I said earlier, you can't always control what those around you are doing. And what was interesting is that about half of the people who took this poll felt like the people in their lives are taking fewer precautions than they were a few months ago, which, as economies reopen, as schools go back to session, college students return to campus, sporting events start to take place, this is not terribly surprising, but it is concerning, that many of us are not necessarily feeling as safe among those who surround us. I mean, the other part of this, it's a little bit hard for me to read here. The good news is that, about 40% or so of people said that most people are taking appropriate COVID-19 precautions, but I think, that's still a large percentage of people who are reporting that they are not. So, this kind of information factors into what we're going to talk about in the next few slides, which is, who are you spending time with? Who are you partaking in these activities with? Because that will play a big role. So when we talk about socializing in a general sense, there's a number of things that you can do sort of globally to make yourself feel a little bit safer. Wearing a face covering obviously is key. Being outside is key. There's been a lot of talk of social bubbles and pods, especially as far as young children are concerned with socializing in school and things like that. Certainly limiting the number of people that you see regularly on a daily basis or a regular basis is generally smart, because it just limits the number of people that you might be exposed to should a COVID exposure happen, and there needs to be contact tracing and whatnot. The fourth bullet, don't touch, hug, kiss others. I know that can be really hard, especially people who maybe have young grandchildren that they want to see, or other relatives that they just, everyone, we're humans, we crave that connection. But I think that, nobody wants to get COVID, and B, if you're a high risk person, if you have underlying health issues, it's especially important to stay vigilant. And so I think, the key message here is, if you're going to socialize, it's important to do it on your terms, outside with face coverings when you can't be socially distant, and with people that you trust and that you know. All right, so let's talk about the gym. We've gotten a lot of questions from folks about going to the gym and exercise. And, one of the things that we talk about all the time with people who have chronic pain and arthritis is how helpful exercise is to the management of your underlying condition. We want everyone to be getting physical activity. We want you to be going for walks, doing exercise in your home. A lot of people, for a lot of people, going to the gym, pre-COVID is a really important part of their lifestyle. It makes them feel healthy. It gives, their daily routine a little bit of structure. And a lot of people really, really miss that. And maybe for other reasons, they're not able to work out as easily at home. So the key with going to the gym, if you're considering that, is making sure that it's as safe as possible for you. And I should caveat everything that I'm about to say with, we're speaking globally here. We're not, providing individual health advice, and everyone's personal health circumstances are different. So if you have any concerns at all about, the degree to which you are high risk or what health conditions may be a particular concern for you, you should definitely talk to your own individual healthcare providers to get their input on these decisions. But in a general sense, going to the gym can be safer if you follow some of these guidelines. So wearing a face covering while you're exercising and going to a gym where others are wearing face coverings. Those requirements can vary by state, so it's important to understand what policies your particular gym has, and not just what they have, but what they're enforcing, so what you see when you actually go there. Avoiding using locker rooms and bathrooms while you're there. You can shower at home, kind of pick what you're going to do to work out, get in, get out. Don't linger for too long. I know many people who have underlying health issues are already well accustomed to disinfecting their surfaces, wiping down equipment, washing their hands before and after exercise. We've all been doing that pre-COVID, many of us who are high risk because of our inflammatory conditions. So sticking to that. A lot of the state guidelines regarding gyms dictate that they limit their capacity. So they have systems that, maybe it's a registration system online so that they know that only a certain percent of the gym will be filled at any time, that they space out the equipment so that the treadmills and the other machines are further apart from each other. So that's really important to understand what the gym physically will look like and how crowded it will be. And even beyond that, if you can go at an off-peak hour, so maybe even though people's work schedules are a little bit, not quite as structured as they were pre-COVID, there probably are still likely times when the gym would be more crowded than others. And if you have the flexibility to go when it's not crowded, that would be better. On the next slide, we offer a series of questions that you can ask the gym about what they're doing to lessen the risk. So asking questions about, do you have a reservation system to minimize capacity? How often is the equipment disinfected? Do you have wipes for patrons to use? Are you requiring employees and patrons of the gym to wear masks? Do you have air conditioning or fans, or are you opening windows and doors? And the answers to these, it's important to pay attention to how they're being answered to. Does the gym answer them confidently? Are you seeing their answers play out when you're actually there? And one of the things that we've shared in all of our articles on these subjects is, try to get on the ground information when you can. So if you know anyone else that goes there, and you can kind of get, some insights from them before you go, just to get a sense of what it's really like in person. That's always ideal. Dining out. Okay, so we all miss restaurants. There's been a lot of news about this. The CDC had there was some data released a couple of weeks ago that found that people who tested positive for COVID were much more likely to have recently dined out than people who did not test positive for COVID. So clearly dining out, there's a number of things happening at one time. You're not wearing a mask while you're eating and drinking. You may be sitting at a table with people that aren't in your household, and you're exposed to them. When you're eating and drinking, it's more likely that those droplets that Dr. George talked about can leave your mouths and nose. So, there's a lot about dining that is not particularly safe when we think about all the things that we want to do to avoid getting COVID. The social distancing, the masks, That said, if you want to dine out, there are things that you can do to make it a little bit safer. Starting with avoiding indoor dining, and there's a big difference between dining indoors, dining outdoors. Another big thing, although part of the reason I think people do dine out is to celebrate and gather with other people, but dining only with those with whom you live, as opposed to going out with a big party or maybe people that are outside of your immediate social bubble. This is, restaurants have guidelines to follow, but it's important to make sure that they're being enforced so that the staff is wearing masks, that the tables are spread apart. There are things you can do to avoid, regarding surfaces, although, surfaces we know are not quite as important of a route of transmission as droplets and airborne, but avoiding using shared items, asking for disposable or digital menus, or looking at the menu on your phone, perhaps. Cleaning your hands before, during, and after the meal. This is important, is, wearing a mask when you enter and exit the restaurant, and if you have to get up to use the restroom, making sure that, you're limiting the amount of time that you're maskless when you're there. One expert gave us this tip about looking at the menu ahead of time to try to kind of figure out what you want to order so that you're not spending as much time at the restaurant as you would have. And, certainly time is a factor. So, this isn't really the moment to linger over a 3-hour meal, but maybe go enjoy the meal, eat, expeditiously, and get out of there before, you're there for an excessive amount of time. The movies. Okay, so a lot of movie theaters were shut for most of the pandemic. Some of the big chains started to reopen at the end of the summer. Similarly to restaurants, movie theaters introduce a bunch of, less than ideal situations, right? There's people that could be sitting in close contact. You're in a contained indoor space for a long period of time, 2 or 3 hours. So, I think if going to the movies is something that you're interested in, it's really important to make sure that you are wearing a face covering. One expert who we spoke to for this really suggested trying to refrain from eating or drinking. Obviously, sharing popcorn and candy, and that's part of the movie experience. But doing that means that you will be not wearing a mask for a longer period of time. Many movie theaters now allow you to get tickets in advance. You can kind of see where you're sitting, and they are trying to have more social distancing between seats and parties. So it's important to kind of understand what your local theater's policies are regarding that. We'd also suggest going during off-peak hours, same with the gym, maybe even, seeing a movie that's less of a hot ticket, so it's a little bit less crowded. If you are at the movies, and we've all kind of had that experience in the past where you see a movie and you're one of 3 people in the theater, and, that's a lot safer than being in a super crowded theater. So again, just keeping in mind that this is introducing, some less than ideal circumstances, but there are things you can do to minimize the risk. Okay, air travel. This is a big one. A lot of people, especially, it's sort of getting into holiday season. People want to spend time with relatives. Are planes safe or unsafe? There's emerging data about this. I think one of the things to keep in mind is, why are you flying, right? A lot of times when during the pandemic, we're flying for a good reason, right? We're going to visit a family member that we feel is really important to see. Maybe we're switching our location temporarily. Maybe we have people who live somewhere else that it's important to kind of get a change of scenery. Most of us are not flying, for exotic vacations right now. And so I think, when you think about like that risk, that internal cost benefit analysis, if you're flying to see a relative that's really important to you or something like that, this is a trade-off that might be really worth making. And so we're not necessarily here to tell you that it's safe or unsafe, but that there are things that you can do to make it a lot safer. And one of the things that is interesting when you think about planes is that, the riskiest touch points aren't necessarily about the air exchange in the cabin, but more about the all the different ways you can be in close contact with people throughout the entire process. So waiting in line at security, waiting around a crowded gate, boarding and deplaning. So really thinking about how can you minimize and maintain social distancing during all of that entire part of the journey. Some airlines, are very explicit about their guidelines regarding maintaining social distance on the flight itself, leaving the middle seats open. So I would really encourage people to look at the airlines that they're choosing and see what those policies are. One piece of advice that we got was about choosing a window seat if you can, rather than an aisle seat, because you will kind of minimize your exposure to people passing by in the aisle. I think a lot of us are used to, kind of viewing planes as germ magnets and disinfecting accordingly. So, wiping down the seat, wiping down the tray table, all of that, washing your hands before and after, and sanitizing throughout, and all of that still stands. But I think the important thing here is thinking that, in a COVID era, it's really about that close contact with people. And so, you can't really, it's possible that you are the unlucky one who sits, in the row in front of someone who happens to be sick, and you can't control that. But wearing masks throughout the flight is really, really mission critical. That's probably the most important thing that you can do to protect yourself on a flight. And then another piece of advice too, and this is sort of not about the flight itself, but having a contingency plan for healthcare at your destination. Many of us do this already, but especially, right now, just, we all, if you have an underlying illness, to know, what kind of, is there a doctor that you could see if you needed to while you're there? What kind of, is there a hospital nearby that you could go to, not necessarily even for COVID, but just for the management of your underlying health issues, just to kind of know a little bit of where you're going before you go. Public transportation. Many of you, I'm sure, on this webinar already have been taking and do take public transportation. It's essential to go to work. It's often essential to go to doctor's visits or run other important errands and activities. So, I think, again, many of the same protective habits apply, wearing the face covering, trying to pick less crowded buses and trains, sanitizing and washing your hands before and after, limit touching, frequently touch surfaces like poles, changing your clothes when you get home, looking to try to travel during off-peak hours. If anyone, is noticing that, as things reopen, especially as depending on where you live, if people are going back to school, things could get more crowded. If your employer or has more flexibility to let you kind of go in a little bit later or leave a little bit earlier, things that you can do to minimize being around a lot of people. The other thing that's interesting that we found in looking into this topic is that public transportation may in fact be safer than ride sharing or carpooling, where you're in a much more enclosed space with people than if you're on an uncrowded subway car and and everyone's wearing masks. So it's important to think about that too, and just maintaining focusing on what you can control, which is wearing a mask and being distant from other people. And I think that concludes my portion of the webinar. So I'll turn it back over to Ben.
Yeah. Thank you so much, Lauren, and thank you to Mike or Dr. George. This is such helpful information, and we're really grateful to have your time to both of you for your time today and to talk us through these are questions I think we all have, and it's so helpful to understand about how the infection spreads and the importance of masking and what we can do to stay safe. So really appreciate this, the opportunity to learn about this and also to ask questions. So with that in mind, we do have a number of questions that have come up, and I'm going to start with those questions that are related directly to the content that you just shared. So most recently, Lauren, you were talking about the rate, the number of cases in someone's area, and also the positivity rate. I think Pamela asked, what's a source where people can what source could people use to find out the number of cases in their area or the positivity rate? And this is really a question either to you, Lauren, or to you, Mike.
I can go first, and then if you want to add, I mean, the answer is it's not always easy, to be honest. I think, you know, state by state, health departments are doing their own version of reporting. There are some national sources, like I mentioned, statnews.com has a good tracking system. Johns Hopkins has a good tracking system. You know, there's information on the CDC's website too, of course. You know, for the sake of this exercise, I went on, I Googled, you know, my zip code COVID-19 cases beforehand and was able to find some interesting information. So I think, you know, I would encourage you to kind of start local, because local is really what matters, especially depending on your state.
Great, thank you. And then another question about just in general keeping safe. And I know we covered a lot of things like travel and gyms and dining out and so on. But I think for people with a chronic illness or an autoimmune condition like JRA, is it safe to attend classes in person, or should people continue to take classes online if they're able to? So Susan asked about her daughter with JRA and said, you know, should she still take classes online? And then some other people asked about, in general, how do you participate in things that are going to be happening in the next few months? And not just going to classes or school, but if someone, for example, Dorothy, you know, talked about having psoriatic arthritis and being on a biologic medication, and knowing that she's going to have a number of parties that are indoor parties coming up in the next few months, is there a way to participate and still be safe?
Well, Dr. George, I'd love for you to take a stab at the JRA.
Laura, you're giving me the hard questions. No, I would love to take this because I think it's really hard. And, you know, obviously in my clinic, this has been constant discussions and trying to figure this out. I mean, I think there's no right answer, unfortunately. There's no way to be 100% safe in anything we do. It's all about trying to balance the risks. So I think there's a few, I mean, all those questions bring up a few points. The first, which is a really important one, which is how much higher risk is, you know, your daughter with JIA or being on a biologic medication? How risky is that? And we don't actually really know the answer to that. I mean, the limited amount of data so far hasn't shown large risks with those medications, but we just don't know. It seems like probably autoimmune conditions may increase the risk to some degree, but older age and other comorbid conditions are probably more important. We think that higher dose steroids are probably a risk, but there's so much we don't know here. So it's hard to even say how much higher risk is she. And then the second piece is, you know, I mean, for everyone's trying to decide, can I send my kids to school? Can I not? Can they spend time with their friends? I saw the question about, you know, having friends over to the house and this sort of thing. So, and so much depends on how much activity is there in your area, how safe are the other people in that area, how good is the school doing at maintaining social distancing, enforcing masks, being really on top of reporting things, if there are cases and kind of shutting down the in-person, if there are cases in the school. So I think there's so many factors here. We are learning more and more, so I think the schools are getting better and on the same page, but I think it really depends on the local level of how much is going on. And you know, the CDC has a nice kind of schematic of like activities that are low risk versus high risk, and that's, I think, how I think about it. This, you know, these are high risk activities, these are low risk activities, these are in the middle. The things that are outdoors, that have good social distancing, these are low risk things. When you're bringing people indoors, it gets higher risk. That's a little bit less if people are all wearing masks and social distancing. And so then the highest risk things are, you know, crowded areas where there's not those social distancing measures and there's not masks. So I think a lot of schools are doing things well. And if the cases in the area are low, I think that a lot of schools do have a good handle on this, but it's a situation that's bound to be changing. Is that the longest non-answer that anyone's ever given?
I mean,
no, I mean, if
point.
Oh,
Like,
go
it's
ahead, Florence.
a great point, and I think what we're seeing from our patients across the country is that schools' responses to this have just varied so widely in terms of whether or not masks are required, whether or not that's being enforced if they are required, how they're handling contact tracing and shutting down when there are positive cases. So, obviously we can't speak to your exact situation, but I think knowing if your school has strict measures in place and you can limit your child's exposure outside of school, like those are things I'd really want to know before sending them back to the classroom.
And I think it's from Mike and Lauren, both of you, it's been helpful just to hear that there are varying degrees of risk and that there are certain things that are clearly higher risk. And so I think people can make, knowing that, just being armed with that information makes it easier for people to make their own decisions about that, to protect themselves and others. But it sounds like typically not wearing masks or being around people who are also not wearing a mask and being indoors close to people, that's just the highest, that's a high risk combination right there, especially for long periods of time. All right, so another question we had.
That another factor is mixing people from different areas. When we talk about family gatherings, especially going into the holidays, in a situation where people are indoors, not wearing masks for a long period of time, like for a Thanksgiving celebration, for example, eating and drinking together, if you're mixing people from, different regions and states, especially those with high community spread, that's even riskier than if it's people from, the same place with low community spread.
Great, thank you. So you talked about Thanksgiving, and Tom asked, as Halloween approaches, do you consider handing out candy a safe thing to do? So Mike, what do you think?
Well, now I'm just going to give you my personal opinion. Again, this depends on your local situation. I mean, what I'm personally planning on doing is having some candy out front in the front door and me being at my doorstep, and as people come up, asking them to take one and chasing after people who take more than one, because that's a big pet peeve of mine. But sort of being out there and being distanced, but still having a chance to interact with people and see their costumes. And I think that's a really important activity. And I think it is something that we can do safely because it's outdoors and we can create that distance. So I do feel comfortable with that, and hopefully communities can kind of figure this out in their local area, how they're going to do it.
Yeah, and I can tell you, as someone with children who are excited to go trick-or-treating, normally every year it becomes a crazy, you wind up with 20 kids ringing the bell at one time. And, the parents in our community are really talking among ourselves about how we can minimize that and go with a very, very small, if people choose to go with a very small group, so that the children can, wear masks, try to, not be on top of each other, and be respectful when they're ringing people's doorbells.
Great. So we don't have to put a pause on fun, it sounds like, as we head into the holiday season, which is good news. So just to go something a little more technical, Jeff asked, his question is specific, and I think it's probably for you, Mike, as a rheumatologist. Are you aware personally, or have you seen within your patient, the patients that are in your care, aware of any COVID-19 infections in someone who's taking a biologic? And either based on research or anecdotally, or talking to your colleagues who are also rheumatologists, are the symptoms different, or is the severity different? I guess, what are you noticing? You alluded to the fact that just really doesn't seem to be much data there, and it doesn't seem to necessarily be play a big role. But what do you see?
Yeah, I mean, well, there are some things that we do know. I mean, we know that it's not like if you're on a biologic and you get this, like, okay, call the priest. I mean, this is certainly not like that. I mean, there's still, so there are many people on a biologic who get this and are asymptomatic or have mild illness and never have issues. Now, are people who are on a biologic or other medications like that at higher risk or not? We really don't have the data to really know that. The limited amount of data we have, there's some data out of NYU and some other areas, suggested that the rates of hospitalization and severe illness were pretty similar in people who were on a biologic compared to those who weren't, but that's pretty limited data. So what I would say is we don't know if there's some risk there. My personal feeling is that there's not huge risk, associated, but I think it's not understanding that middle ground. How much risk is there is a little bit unclear.
Great. And then another question, again for you as a physician, Mike, and I know some, to a certain extent, the jury's out here, and we don't have all the data that we probably need to definitively answer this question. But Angelica asked about her husband, who was positive before for COVID-19, and now he tests positive for the antibodies to the COVID-19 virus. And she just wonders, what does that mean? Does that mean he won't get the virus again? He won't be infected again because he's sort of, immune in quotation marks from COVID-19 at this point?
So based on everything we know about this virus so far and about other viruses, he probably is relatively protected, at least in the near term. We don't know exactly how long that immunity lasts. We don't know if everyone develops protective immunity, but chances are he's at least somewhat protected. He's probably less likely to get the virus. If he does, he's probably less likely to have severe illness. At least that's what we know so far, or that's what we think so far. But nothing's 100%. So don't tell him to put on his Superman costume and go running around the movie theater. But he hopefully has at least some protection.
Great. And then a couple other medication-related questions for folks like Maureen and Tiffany on here. We talked about biologics, but what about corticosteroids like prednisone, and what about methotrexate, another DMARD, that's not a biologic? What does that do to someone's risk?
Well, the data that we know about methotrexate and infections in general, pre-COVID, is that there is not large infection risk with methotrexate. It is a fairly safe medicine. At least the rate of serious infections is not substantially different in people on methotrexate versus those who aren't. Steroids are a particular interest of mine, and high dose steroids, are a major risk for infection. So doses, especially if you're on, high doses, 15, 20 milligrams for a prolonged period of time, that really increases the risk of infections in general. And I think probably the same is true here, and we're seeing some evidence of that. And it can be confusing because steroids are also being studied to treat this in people who have severe illness. But I think there's a big difference between being really ill and getting a short burst of steroids compared to being on steroids for months and months and months. It does something very different to your immune system to be on high dose steroids for long periods of time. So of all the medications that people are on, I think long-term use of high dose steroids is probably a risk. Of course, also having uncontrolled disease is a risk. So I think this is not a reason to sort of be stopping medications or saying, oh, well, I'm not taking those steroids. But I mean, if you need them, you need them. And having your disease under control is also very important. And that's where I think communicating closely with your doctor is really important, and trying to balance the risks and benefits of different treatments. But the American College of Rheumatology has recommended, whatever treatment you need for your disease, you should be on it. You can talk to your doctor about trying to optimize it to have you on the safest regimen, but continuing medications unless you get sick is very important.
Great, thank you. That's helpful. And this is, we're just about at the top of the hour here. And so one last question, very important we've been talking in this whole webinar about how to avoid becoming exposed, avoid becoming infected or spreading infection. But someone in the chat window just, mentioned some symptoms they're having: fatigue and dizziness, nausea, fever, chills, and so on, weakness. What should they do? What should folks do if they are finding that they're experiencing symptoms? What's the best approach? And especially, when they suspect it might be COVID-19.
So this is hard, and also we've heard from a lot of people also it can be hard to tell the difference between a flare of your condition and being ill. I mean, it can be hard to know, and the symptoms are sort of non-specific, and we're coming into cold season as well. So I think this is going to be an answer that changes a lot over time, depending on what the COVID activity is in the area, what other illnesses are in the area. But I do think that it's really important to communicate with your physician if you are ill, so that you can decide together, is this something that should be tested for? The tests are, of course, not perfect either. So should it be retested if you're still ill, you're not getting better? It is a very individual case-by-case thing. And we get lots of questions about this in our office. and are very open to hearing from people trying to figure this out. So I would encourage you to reach out to either your rheumatologist if you have one, or a primary care doctor. And those folks have been, on the front lines of understanding how to do testing and when it should be done.
Great. So basically the bottom line is, if you're not feeling well, and it sounds like that person, Maureen, I think, who put that in the chat window, contact your doctor and get some more guidance from your own physician about that, because it sounds like it's important to take care of that as quickly as possible. So we're here arriving this time. Always goes so quickly, especially when we have such an excellent panel like Dr. Mike George and Ms. Lauren Gelman, who we've had the pleasure of getting to hear from today. So thank you both very much, Lauren and Mike, for taking your time, and really to everyone, Shilpa Venkatachalam and Jess Bowles and others who helped put this together, and Danielle, who organized this. So big thank you to our friends at University of Pennsylvania School of Medicine, and also, of course, Chief Joins Global Healthy Living Foundation. As always, we're delighted to do these, and thanks to all of you, the patient participants and others who were part of this webinar tonight, in terms of paying attention, asking great questions. And as we mentioned before, this is being recorded, so you can watch it again, share it with others. And we always appreciate your participation, your comments and feedback. So we look forward to seeing you on the next one. Thanks, everyone. Have a great evening.